there's paroxysmal atrial fibrillation, which means atrial fibrillation comes on and goes away on its own, and you can have multiple episodes, and patients typically do. You have persistent atrial fibrillation, where atrial fibrillation actually lasts for at least 7 days, or they last long enough and cause enough symptoms where a patient needs cardioversion, which is shocking the heart into a normal rhythm. Or you have long-standing persistent atrial fibrillation, where patients have been in atrial fibrillation continuously for at least a year. We used to call this permanent atrial fibrillation. Now permanent atrial fibrillation is in patients who have atrial fibrillation, and we've pretty much decided that doing anything to restore normal rhythm is not worth it for any host of reasons. And what we see is the success rates in paroxysmal AFib, which is the earliest stage of atrial fibrillation, are much higher than the success rates in patients who have long-standing persistent atrial fibrillation, and there's a whole spectrum. So the earlier we get to ablate somebody, the more likely they're going to have. AFib ablation is, I wouldn't say new, but is really progressing quickly in terms of technology recently. We have a lot of patients who have had atrial fibrillation and weren't ready to get ablation because the technology wasn't there, and are now persistent AFib or long-standing persistent AFib. And they usually need more than one ablation. Usually they're 6 months, a year apart, maybe 2 years apart. But if we're able to catch somebody early where the atrium, which is the area we ablate, is nice and small, success rates are much higher. But once you have AFib for a long time, it causes more inflammation in the heart and more scarring, more fibrosis, and that atrium gets bigger. So when that atrium gets bigger, there's a lot more ablation we have to do. And when we have to do more ablation, there's a lot more chance, or a lot higher chance, that we won't be successful in completely getting rid of atrial fibrillation.